All right, now to a breakthrough in the treatment of Alzheimer's. A new therapy that rests magnets on the brain is said to improve early symptoms of the disease. The world-first Australian trial has already seen some elderly patients report improvements on their memory and concentration.
Now, for more on this, we're joined by Dr Helena Popovic in Brisbane. Dr Helena, great to see you again. How can magnets manipulate brain activity?
By placing magnets just on the surface of the head, a magnetic field stimulates brain cells which are near the surface of the head. And what we believe this is doing is breaking up a protein that forms plaques around brain cells, chokes the brain cells and disrupts communication between brain cells. It's called transcranial magnetic stimulation, TMS, and it's already been trialled for conditions such as schizophrenia and depression with good results and so far no side effects, but it is early days. However, this is a slight modification called theta burst stimulation. For depression, you need 40 minutes of this magnetic field. For Alzheimer's, what they're doing is they're targeting 4 areas of the brain that are affected by the disease, and it's a really short, intense, high-frequency burst that only lasts 3 minutes, which is actually quite remarkable. So the person emerges and says it feels like a fogginess has been lifted, and relatives have even reported that they seem to communicate better and have better memories.
So just to be clear, sorry, Dr Helena, to interrupt, just to be clear, this isn't an invasive surgery, is it? So you
it's a non-invasive.
Right.
It's completely not. You're awake, you're alert. Patients report it feels like somebody's just tapping on their forehead.
Right.
How fascinating. How does it compare to other Alzheimer's treatments already on the market?
So far, we've only got a few drugs and they only work for some of the people some of the time. The drugs target chemicals that the brain fails to produce, and it just stops the brain breaking down those chemicals, such as acetylcholine. But once the brain stops producing these chemicals, the drugs don't work. So they only possibly halt the progression of the disease in people.
But sorry, keep going.
And I'll just say the difference with the magnets is we're not even sure if it works on the plaques. I think it works in a broader way because we've found people whose brains are riddled with plaques that don't have Alzheimer's and other people with no plaques but that do have symptoms of Alzheimer's. So I think it's something about really changing the way brain cells communicate with each other. This is the magnets, whereas the drugs are just working on a very small percentage of the population with certain chemicals not being produced in the brain.
Right.
Can you see this still being successful in patients with advanced Alzheimer's, or is it ideal to get them right at the beginning, the early onset?
The earlier the better.
Yeah.
It's always the case. But I think this has a lot of promise.
So when can we see this therapy rolled out on a wider level?
Before it's rolled out, Monash Alfred Psychiatry Research Centre is actually looking for 100 volunteers, people aged between 50 and 95, that have been diagnosed with mild to moderate symptoms of Alzheimer's, that are prepared to come in for 21 of these treatments. Now remember, they only last 3 minutes. They only need them for a 6-week period. And they want to collate more research to see exactly who it's helping and how much it's helping them. So, feel free to go to their website, contact them. They'll be really happy to hear from you. And in the meantime, we've actually found a really powerful thing that halves your risk of developing Alzheimer's is to start to really live a life of meaning and purpose. After you retire, find things that give your life a sense of meaning and direction, and doing random acts of kindness and volunteering. Remarkable as it sounds, this is a big help.
That's really interesting. Dr Helena Popovic, thank you so much for your time this morning.
My pleasure.